Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Discharge Instructions General. Introduction. After your hospital stay, you will need to take care of yourself. These discharge instructions will help you understand what to expect, how to take care of yourself, and when to call your healthcare provider. Make sure you have written instructions too, so you can take them home and review them. This program explains general discharge instructions. Make sure to discuss discharge instructions specific to your medical condition with your healthcare team. Activity. When you go home, if your condition permits it, you need to walk several times a day to prevent blood clots from forming in your legs. When you sit down, try to prop your legs on a stool to prevent clots from forming. If your condition prohibits you from walking, such as wearing a leg cast, you may be taught to do leg or foot exercises several times per day to prevent clots. To allow your body to heal, you should not do any of these things until after your follow-up appointment, unless otherwise directed by your doctor. No heavy lifting. Do not lift anything more than 10 pounds. No heavy housework. No driving. No sex. No work. Diet. Patients who have had anesthesia may feel nauseous the first day after the operation. Soups may help settle the stomach. It is important to drink a lot of fluids to avoid getting dehydrated. Constipation is common after surgery. It may be necessary to take a stool softener for the first month. Foods that can help resolve constipation are pureed prunes, applesauce, and oatmeal. Drinking plenty of water and moderate exercising also helps. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Incision. Your incision, if any, may have been closed in one of many ways. If closed with staples or stitches, the incision should be kept dry until the staples or stitches are taken out. This is usually within 7 to 10 days. When closed with special skin glue or Steri-strips, the incision may not need to be kept dry. A shower is usually permitted and the glue or strips peel off on their own within 10 days. Medications. Your doctor, nurse, or pharmacist will explain the medications you should be taking. Most people get their medications and instructions from the discharge pharmacy on the way to their car. You may need some of these medications, such as pain pills and antibiotics, for a short time. You may need to take others for a longer time. Make sure you understand which medications you should take and how often and for how long you should take them. Most importantly, make sure you understand the reason for taking the medications and their possible side effects. Check with your doctor, nurse, or pharmacist to see if there are any over-the-counter medications you need to avoid. This is especially important if you are taking blood thinners. It is always a good idea to ask your healthcare provider or your pharmacist about any new over-the-counter medications or supplements you may want to take. When discussing your discharge with your doctor, be sure to mention what medications you were taking at home and ask which ones should be continued when you are discharged. Ask your healthcare providers to contact your primary physician and tell him or her what you had done in the hospital, what to expect, what type of follow-up is needed, and what medications you went home on. This information may also be accessible to your primary physician in the computer. What to watch for. Call your doctor or nurse if your incision becomes red, hot, swollen, or starts to leak. Your temperature is greater than 101 degrees Fahrenheit. You have any severe leg pain, swelling, or chest pain. These may be signs of potentially deadly blood clots. You have persistent nausea or vomiting. You have severe pain. Just ask. Do not be afraid to ask any questions related to your health and recovery. Here is a list of 10 common questions you should ask your doctor and healthcare provider before you go home. 1. What medications should I take and when? 2. What are the signs of infections and other common complications? 3. What should I eat? 4. What will happen to my stitches and staples? 5. When will I see the doctor again? 6. When can I drive my car? 7. When can I go back to work? 8. When and how can I shower? 9. How much weight can I lift? Can I bend? 10. When can I make love again? Going home. As soon as the day of admission, you may be visited by a discharge planner. This is because it sometimes takes a day or two to arrange special equipment or take care of special needs for going home. The discharge planner will work with you during your stay to help make the transition home or to an extended care facility go more smoothly. Most patients pick up their medications at the discharge pharmacy on the way to their car. This enables the pharmacist to look over your medications and discuss any changes or limitations with you. Your doctor will answer questions for you on the day of discharge. Your nurse will go over any special instructions you have, check to see that you have everything you came with, and will arrange for transportation to your car. Most patients are discharged before 11 a.m. You should arrange ahead of time for a friend or family member to drive you home on the day of discharge. If you are having difficulty arranging transportation, let your discharge planning nurse know. We may be able to assist you. If there is a copay for your stay, it can be taken care of on admission any time during your stay or on discharge. A member liaison will contact you, or you can visit the admitting office on your way out. Your family can also take care of the copay for you. If you need special arrangements, let us know so we can work with you. If you like this video, please like and share. For similar videos, subscribe to our channel. Follow-up. We will help you to set up an appointment with your doctor or healthcare provider in a few days or weeks. Sometimes your healthcare provider expects you to call the office to set up the appointment. At the follow-up appointment, make sure to bring a written list of questions. These are examples. When can I resume my usual activities? When can I have sex? When can I drive? When can I work? When can I play sports? When can I travel? What are my restrictions, and for how long? Do I need any more therapies, such as physical therapy? Do I need any more follow-up appointments? Which medications should I keep taking, and which can I stop taking? Ask your physician to share his or her findings and instructions with your primary physician. Please give the name of the physician to your hospital doctor or nurse. Thank you for using Explain.